Hi, this is Dr. Charles Feinstein, and I'd like to thank you for watching our video on different aspects of urinary incontinence. I'd like to mention to you that we have an exciting new treatment for urinary incontinence. A specific type of incontinence is the overactive bladder, and the specific overactive bladder is the type that is resistant to all oral medications. Overactive bladder means the lady that you see advertised on TV, gotta go right now. That lady has spasms of the bladder, has urgency, and that's what we call the overactive bladder, OAB. There are millions of women in America who suffer from overactive bladder, or OAB, and they have to run to the bathroom in a big hurry. They may have to go to the bathroom every 2 hours, every hour, every half hour, even more often than that. And there's two types of OAB, or overactive bladder. There's wet and dry. Dry overactive bladder means that you got the urge that you have to run to the bathroom, but you get there in time and you don't leak. Wet overactive bladder means you get the urge to run to the bathroom in a big hurry, but you don't get there in time and it leaks before you get there. That's the typical lady who puts her hand on the knob of the bathroom and she's turning the knob to get into the bathroom. She only has 2 feet left to go to get into the bathroom, and it's too late already. The urine is coming out just when she puts her hand on the knob and is turning the knob to go into the bathroom. It's too late already. She has wet overactive bladder. She's having bladder spasms and they shoot out the urine without her control. The typical treatment for that is medications, and the medications have been around for many, many years. And the medications, by and large, are successful. However, the problem is that most patients don't stay on the medicines for more than 2 months. And if you start these medicines, you have to stay on them for the rest of your life. So if the lady quits after 2 months because of side effects or because she's simply tired of taking medicines, obviously it's not going to work. The new and exciting treatment that we have is Botox. Now, everybody has heard of Botox, and the Botox is used for these wrinkles that are right over here. Wrinkles on the forehead, wrinkles on the skin, wrinkles on the face. That's been done for 20 years by plastic surgeons. The new and exciting news is that Botox has just been approved by the FDA for use in the bladder. We have had magnificent results from the use of Botox on uninhibited bladders, spastic bladders, overactive bladders, bladders with dysfunction from neurological problems. We recently had a young lady who had multiple sclerosis. She's 36 years old. She's been in a wheelchair for 5 years. And in the last 5 years, she's had severe urinary incontinence. She wore adult diapers at least 5 per day. She has tried every medicine that's ever been invented, and none of them have worked on her urinary incontinence. Again, she had multiple sclerosis. We gave her injections of Botox into the bladder, and within a day or two, from 5 diapers a day, she went down to 0. She was completely dry for the first time in years. And she said, Dr. Feinstein, you gave me my life back. And that's why we're so enthusiastic about Botox treatment for overactive bladder, uninhibited bladder, bladder spasms, neurogenic bladders, things of that nature, especially where they've tried all the different medicines and the medicines have not worked. And they were at their wits' ends wearing adult diapers or 5 pads per day, soaking wet, and now these ladies have the potential to be completely dry thanks to the new advancement using Botox for bladder injections for overactive bladder. If you'd like more information on overactive bladder, please come to our website, which is drfeinstein.com. That's drfeinstein.com. Or please watch our other videos, which are available on YouTube. Thank you very much for watching this informative video on urinary incontinence and overactive bladder. Thank you again. Have a great day.